And we are back. And as I said at the top of the program, there are two people who are from our area who are currently working in New York City, helping out with that situation there. The second person joins us now. She is Brittany Grybos. She is from Bloomsburg. Welcome, Brittany.
Hi.
So fill us in on your background a little bit.
So I graduated high school from Shamokin. I went and got my undergrad, my bachelor's in nursing at Misericordia up in Dallas. And I've been working at Geisinger in Danville in their adult ICU it'll be 6 years in June. And I'm also finishing up my nurse practitioner degree, acute care nurse practitioner here. I'll be done in September, and that's through Drexel.
Okay, so back in March is when things started to head south for everyone. What was your reaction at that point?
So I had heard a little bit about it when it was happening in China, and I kind of followed it a little bit, not knowing what it would end up being, but I kind of knew about the virus and like that they were struggling a lot over there and things like that. And then the concern was present that, that it could have come over here. I didn't expect it to be like it has, but basically when I heard about it hitting in New York, it's not a surprise that it hit them so hard. Everyone's on top of each other there. I just couldn't imagine. I work in ICU, and I just couldn't imagine the things I was seeing and the photos and things like that I was hearing. I just couldn't imagine having to deal with that. And I also was scared that, I work in the ICU here at Danville. We're a big hospital, that we would be facing the same challenges at some point.
So at what point did you decide to do what you did? And why did you decide to?
So back in June, I went per diem at Geisinger just because I had clinicals. I was doing clinicals for my nurse practitioner degree. I did them up at GWV in Wilkes-Barre and then GCMC in Scranton. And I was already planning to do my spring quarter at GWV for about 10 weeks. And then that had been canceled. So basically what I had done before was I had gotten my clinical schedule and then worked, because I'm per diem, I kind of based my work schedule around that. And then when my clinicals are canceled, I had all this free time, and I have to work 24 hours a month at Geisinger, which I worked a lot more than that. I basically worked full-time hours, but I just needed the flexibility of my schedule. And then when I was hearing about everything that was going on up there, I really started considering that I had the opportunity to go, because I'm not, I don't have to work full time at Geisinger if I didn't have to. So that's when I decided to look into it a little bit more.
So what was that process that involved in looking into a little bit more? How did you go about doing that?
So I actually have a coworker that I was thinking about it for a while, kind of looking into some things. I've never done like travel nursing or anything like that before, but then I heard about a coworker that I'd worked with about 2 years ago that people had said that he was going up at the end of March. So I reached out to him, and he told me who he was going up with, what agency and what recruiter. And I reached out to them. And once you reach out to any travel nursing, back in March, or even still now, once you reach out to one, they just don't stop, because they know that you have ICU experience and they know that the needs are there. I had like, oh my gosh, 8-10 people contacting me every single day. But it was really hard because I've never done this process, so I didn't really know much about it. So basically, I just made it easy for myself, and I was like, I know this coworker, and he's been traveling with this recruiter in this company for 2 years, and he likes them. So I just went with them. I just went with someone that I knew.
So what about Geisinger? Did you have their support as well for this?
Yeah, absolutely. Yep. When I presented it to my managers, they said basically they want me to be safe, obviously, and they were worried because they didn't really know what it was like up there. A lot of people were hearing that it wasn't good for nurses at the beginning with the whole PPE shortage and things like that. So they were worried for me, but they totally supported me. They basically waived the first month. I don't have to work my 24 hours. that I normally would have to work to keep my position. So they said that your position will always be here for you when you come back, and they were really supportive.
So did you have to sign a contract that well, first off, where did you end up and how long are you going to be there? And did it involve some sort of contract?
Yeah, I had to sign a contract. I'm at New York Presbyterian Health System, but I'm at their Columbia University Hospital. So I signed a contract. They initially wanted about 13-week contracts is what they were doing, but since it was my first travel job and just everything that I heard about up there, I didn't know what to expect. So I asked if I could just have an 8-week, and they most likely will ask me to extend. So I'm due to stay up there until June 6th.
In Columbia, in Columbia University, that's one of the ones we're hearing about as far as how bad it is.
Well, actually, I mean, I don't know how to compare because I've only ever been there to other hospitals, but I have had a really good experience with them. So it is bad in regards to how many patients they have and what they needed to do to basically convert that hospital into what those patients needed. In that sense, yes, it is, but they have gotten a lot of help, and they've really, really done a good job of like basically doing what they need to do for the hospital and for these patients. I mean, it's way out of their comfort zone and what they're used to doing. So right now, they took an old med-surg floor and converted it to an ICU. So you have to imagine, I mean, if you know what an ICU normally looks like and you know what a med-surg unit normally looks like, it's a challenge. But they've been doing their best as far as like monitoring systems and cameras so you can see inside the rooms, but yet these rooms are negative pressure rooms, obviously, so they have to be closed so you can't see the patients, but they've set up cameras and monitoring systems, and they've really gone above and beyond for what they need to do to make these units what they need to be. I mean, there's still like a lot of ways to go, but they're trying their best.
So when did you go up to New York City? And where do you stay? Is that part of the contract? Did they provide housing as well?
So I went up the 16th of April was my first day. So the company that I go with, they don't do housing, but actually, so AACN, so the American Academy of Critical Care Nursing, they partnered up with Hilton and American Express, and they're doing 1 million free hotel nights. So I've stayed in a hotel for free the entire time. And now that's any hotel, like that's Times Square, any hotel that's affiliated with Hilton in Manhattan. It's all of the 5-star resorts. Now I'm staying outside, like about 1.5 miles outside the city because I want to have my car, and the parking is just, it's a disaster up there. So I want to have my car, so I travel to the hospital.
So what was your first day like, and were you a little nervous your first day?
Oh, absolutely. Yeah. I mean, travel nursing in general, I mean, lots of people leave Geisinger to go and travel, but it's definitely nerve-wracking. But going into a situation like that it made me very nervous. But so my first day, I did have a first day to be able to shadow with another nurse, which I didn't expect. I kind of expected to get kind of like thrown in there, but I did have a full shift with another nurse. But my first day off was actually they converted 24 operating rooms into ICUs. So in each operating room, there's 4 patients in each room, and then we kind of have like pod teams. So that was an experience in itself to be working in an ICU and an OR. And, another challenge is they're doing their best, but, they're having to pull, like you said, Jake normally is working in dentistry and kind of got pulled into working in the COVID unit. I mean, my first day, I'm working with psychology residents, people that's just not their comfort zone is in an ICU. So, and not only physicians, but they needed critical care nurses too. They were putting, clinic nurses and things like that just because they needed people. So when they saw us come through the door, like I wasn't really sure how receptive they would be of travelers, but they they were so appreciative. Everyone, they were just so happy to see us, and just people that knew and were comfortable with that environment. There's people working. I know some people I talked to worked like 14, 15 days straight, 12-hour shifts.
Wow. That's amazing. So how much did your experience at Geisinger in ICU help you there?
A lot. It helped me a lot. Absolutely. As far as the patients and what they need, I don't have a problem with it. Like, that's my comfort zone. I got really, really good experience from Geisinger. There's not something that I haven't seen up there that I wasn't comfortable with.
Now, from what I understand, at Geisinger, the most they use PPE for is for like tuberculosis patients. So was this your first time having to deal with PPE?
No, because actually before I left Geisinger, we had converted some units to COVID units, and we were seeing COVID patients before I left. So we kind of got the whole PPE system kind of down pat. Even before I left, I was working with COVID patients at Geisinger, which was another reason why I thought about going up, is because either way, no matter where I'm at, I'm going to be exposed to these patients.
So how has it been since? I mean, my estimation, 2 weeks up there, 2 weeks of working up there. How has it been since that first day?
So it's been good. I mean, it's a challenge, but I think basically by the time we got up there, and now things are slowing down in regards to new hospitalizations, new patients coming in. I mean, these patients require really long hospital stays. So once they're there for a while. But as far as like people coming in every day, it has slowed down. So it kind of gave them a chance to like breathe a little, and now they have staff that can help them. So it hasn't been bad. Like, they've been really, really good to us.
And a lot has been made in the media about their PPE shortages. Did you run into that as well?
So like I said, I don't know. I can't speak for other hospitals, but I have had as much PPE that I need at Columbia. They have been really, really great. I think that I was at a health system that, like, one of the better health systems up there. I was seeing, some other hospitals that, I keep seeing, because I'm part of like a travel nurse site now on Facebook, and people are still having challenges up there. But I haven't experienced that at all. Like, we have as much PPE as you would want up there, as much as you're comfortable with. They also let you, if for some reason you didn't feel like the N95s were up to par or something, you can bring in your own. You can bring in your own respirators. They basically allow you to bring whatever you need to make yourself feel comfortable.
Now, have you pretty much seen the gamut of cases up there, from some of the less severe hospitalizations to the more severe ones?
So basically, like I said, these patients, once they come in, and most of them do require ventilation, a breathing machine. Once they come in, it's just they are very sick. They're just going to be there on the ventilator, needing that ventilator for a while. So these patients, I had a patient that was actually on the ventilator for like 31 days.
Wow.
Mm-hmm.
Is it hard to deal with, and I've heard a lot of this, hard to deal with the situations that ultimately end in death?
It is hard. It's not something, I mean, it's hard, obviously, but like, I work in an ICU. I've been in an ICU for 6 years, so I kind of know how to handle death. I mean, it sounds terrible, but when you work as an ICU nurse, that's the reality of it, that you're going to be seeing that. I mean, there's definitely more than what I'm used to. There's a lot more deaths during this situation than what I'm normally used to. But as far as like handling it, it's not something that I'm, it's something that I'm used to doing. But there is a lot more of it, which is really unfortunate. A lot of these patients are unfortunately dying.
So are you worried at all about getting COVID?
I am. Yeah, absolutely. Absolutely. That's a concern. And like I said before, that, a lot of people were like asking me why I decided to go up there. I'm kind of throwing myself into the fire, like at the center of it. And I said, I'm going to be exposed to COVID no matter where I go. I can be exposed to COVID going to the grocery store like the average person, but I also was working with COVID patients at Geisinger with the same PPE that I'm working with in New York. So it's kind of like the risk is always there no matter where I go.
So what is it like in New York City in general? We see pictures of empty streets. Are you seeing that as well?
Yeah, absolutely. Yeah. I mean, pretty much it's just people to and from work in the morning. You know, in the morning there's a little bit more people because they're either walking or they're, people are driving, but it is not the New York City that you're used to. It is empty. I was actually having some trouble, like when I would get off work, even just finding somewhere, because I don't eat fast food. So even just finding somewhere to just pick up dinner, there's so many restaurants closed. You couldn't find anything. It was a real struggle actually to find food after work. So that's another thing the hospital's doing is they're offering breakfast, lunch, dinner every single day to every single employee in the hospital.
But I'm sure if you spend enough time there, you probably want to get out of there as soon as you possibly can and not eat there, maybe.
They're bagged up though. They're bagged, so you can just grab your bag and go.
Well, that is convenient. I will give them that. So on your days off, you were actually in a 6-day stretch off here now?
Mm-hmm. Yep, as of yesterday, yeah.
So and then you expect once you go back, you won't be back again until you're done.
No. Mm-mm.
Okay. And what do you do on like days off when you're there?
So study. Like I said, I am finishing up my nurse practitioner degree, so that it's actually kind of nice that I have like that extra time to study. But at the same time, it's sad because I have a 3-year-old daughter at home, so being away from her is really, really, really tough on me. But I basically that's why another reason why I made it 8 weeks is because I kind of I didn't want to commit to something if it was going to be really hard, really, really difficult for me to be away.
How is your family dealing with this?
So my parents were nervous for me and they didn't like the idea at first, but when I kind of explained to them, because everyone's nervous that I'm going to get sick, obviously, but when I explained to them that the risk is always there, no matter where I work, because I'm an ICU nurse, it kind of made a little bit more sense to them. But they obviously all want me to be safe. My husband's been really great, really, really great. He's been a stay-at-home dad because he's a teacher, so he's obviously been home since this all started, but he's doing really, really good. He's a rock star at being a stay-at-home dad, so that's not a problem. I didn't have a worry at all leaving him at home with her.
Okay, Brittany Grybos, thank you very much for your time today. Amazing stuff you're telling us here. I do ask this question at the end, although it's pretty much taken for granted with you, but besides dealing with it, being in the pits, being in the belly of the beast as you are, how are you dealing with this personally?
I'm just, I'm talking to a lot of people, when I get off work, I call my husband or I call my mom and kind of just vent a little bit, just to kind of talk to someone that I'm familiar with. And that's what I do on a normal day at work. If I have a really hard day, just kind of just call family and explain, they don't have any idea what I'm talking about, but I just to vent. So that's what I do basically, is just talk with them.
Okay.
Or FaceTime my daughter, see her, and it kind of makes everything better.
All right, Brittany Grybos from Bloomsburg, a nurse and now working up in New York City to help out with that situation up there. Thank you very much for your time today.
Thank you.
And good luck moving ahead here. And that's going to do it for this episode of In Your Neighborhood special series, Conversations on COVID-19. I'm your host, Chris O'Rourke. Thanks for joining us, and stay safe out there.